likely around this time to confirm that he plans to continue with his roadmap, the next stage of which is due on Monday, reopening, for instance, allowing people to see each other indoors in private homes, and for hospitality to open up inside in groups of 6. Some venues can allow in up to 1,000 people. So possibly actually the most significant of the various points along the roadmap to go ahead. But there's been a but, and it's a but that has really descended on Whitehall this week. So a bit of a chill down Whitehall this week in the form of the Indian variant. You've got that tripling of cases in the northwest, all of a sudden undermining the complete confidence that the government had at the start of the week that not only this bit of the roadmap, but the one that follows in June would progress without too much problem because of the extraordinary pace of the vaccination regime. Now suddenly you've got a variant that is one of the variants that has come over from India, but only one of them has been designated a variant of concern. And the issue really is that, talking to scientists throughout the day, that they just don't know a huge amount about it. It seems that the Indian variant that is currently prevalent in the northwest, particularly in areas like Bolton, seems to pass through the population, is more easily transmissible even than that Kent variant that we saw, which caused so much damage, so much misery just before Christmas. But, and it's a very, very big but, there has been so much progress with the vaccination regime that it looks as if it's holding up against this Indian variant without too much problem. Scientists are scrabbling to work out what the interaction is of the new variant coupled with the vaccines. So Boris Johnson, I suspect, will press the green go button on for Monday to go ahead. But the following months, basically complete total relaxation of the rules on June the 21st, I think that will possibly come under more strain.
Do you think he might announce something about vaccinations for younger people in these hotspots, which we're learning about? We heard from Inzamam Rashid there in Sefton that one pharmacy was going it alone.
So I think one of the things that government are grappling with is essentially whether or not to double down with the second dose to older people of the vaccine, particularly in areas where the Indian variant is prevalent, or whether or not that it would be a better idea to start moving down the age ranges in order to vaccinate younger people who currently are exposed. It's the unvaccinated, I suspect, the data certainly suggests, are most at risk. And this would be a question for government advisers. Here is Boris Johnson.
Throughout this pandemic, we've tried to keep people abreast of the latest information as soon as we get it. And since I spoke to you last Monday, we've seen further clusters of the B1617.2, the variant first observed in India. And we've seen it especially in Bolton, in Blackburn with Darwin and some other parts of the country. At this stage, there are some important unknowns. We believe this variant is more transmissible than the previous one. In other words, it passes more easily from person to person, but we don't know by how much. I'm told that if it's only marginally more transmissible, we can continue more or less as planned. But if the variant is significantly more transmissible, we're likely to face some hard choices. And we're going to be learning a lot more in the coming days and weeks about that. The good news is that so far we have no evidence to suggest that our vaccines will be less effective in protecting people against severe illness and hospitalisation. So that means we're in a different position from the last time we faced a new variant before Christmas because of the scale of our vaccine rollout, which Public Health England estimates has already saved almost 12,000 lives and prevented over 33,000 people from being hospitalised. So I believe we should trust in our vaccines to protect the public whilst monitoring the situation as it develops very closely, because the race between our vaccination programme and the virus may be about to become a great deal tighter. And it's more important than ever, therefore, that people get the additional protection of a second dose. So following advice from the Joint Committee on Vaccination and Immunisation, we will accelerate remaining second doses to the over 50s and those clinically vulnerable right across the country so those doses come just 8 weeks after the first dose. And if you are in this group, the NHS will be in touch with you. We will also prioritise first doses for anyone eligible who has not yet come forwards, including the over 40s, and I urge anyone in those groups to come forward as soon as you can. At this stage, there is no evidence of increased cases translating into unmanageable pressures on the NHS, even in Bolton, and infections, deaths and hospitalisations nationally remain at their lowest levels since last summer. So, and this is a balanced decision, I do not believe that we need, on the present evidence, to delay our roadmap, and we will proceed with our plan to move to step 3 in England from Monday. But I have to level with you that this new variant could pose a serious disruption to our progress and could make it more difficult to move to step 4 in June. And I must stress that we will do whatever it takes to keep the public safe. Our surveillance and data gathering is now so advanced that if there was a danger of the NHS coming under unsustainable pressure, we would see the signs in the data very early on and could react in good time. And that gives us the confidence to continue moving forwards for now. But I urge everyone to exercise the greatest caution, because the choices we each make in the coming days will have a material effect on the road ahead. To those living in Bolton and Blackburn, I'm very sorry that you're once again suffering from this virus, and I know how hard it has been for you, having been in a form of national or local lockdown for longer than almost anywhere else. But now it's more vital than ever that you play your part in stopping the spread. So we won't be preventing businesses from reopening on Monday, but we will be asking you to do your bit. Take the vaccine when you can, get your free twice weekly rapid tests, and if you do test positive, you must self-isolate, and we'll provide financial support to those on low incomes to help them do so. As we move away from living our lives by government rules, and as we learn to live with this virus, then, as I said on Monday, we need to make our own decisions about how best to protect ourselves and our loved ones, informed by the risks. And for those living in Bolton and other affected areas, there is now a greater risk from this new variant, and so I urge you to be extra cautious. Our best chance of suppressing this variant is to clamp down on it wherever it is, and we'll be throwing everything we can at this task. Colonel Russ Miller, Commander of the North West Region, will be deployed to support local leaders in managing the response on the ground. There will be surge testing with mobile testing units, and the Army will be on the streets handing out tests. And there will be targeted new activity in Bolton and Blackburn to accelerate the vaccine take-up amongst the eligible cohorts, including longer opening hours at vaccination sites. And to everybody else across the whole country, wherever you live, please get tested twice a week for free and get a jab if you're eligible. Remember, hands, face, space and fresh air. Observe social distancing from those you don't know. And if you're seeing loved ones, think really carefully about the risk to them, especially if they haven't had that second dose or if it hasn't yet had time to take full effect. I want us to trust people to be responsible and to do the right thing. That's the way to live with this virus while protecting the NHS and restoring our freedoms. And it's very clear now we're going to have to live with this new variant of the virus as well for some time. So let's work together and let's exercise caution and common sense. Thank you very much. I'm now going to ask Chris to do the slides.
Thank you, Prime Minister. First slide, please. The first slides are very familiar to people watching these briefings. The first one is the number of people testing positive for COVID-19 in the UK, and as you can see, that has been on a steady downward path and is stable in terms of the overall numbers at this point in time. Next slide, please. We're also seeing, as people will be aware, a steady decrease in the number of people in hospital with COVID-19 in the UK, as this graph shows. Next slide, please. And the number of people who have died following a COVID test has also been steadily decreasing and has remained very low and remains low now. So the most recent 7-day average is 7 deaths a day. Next slide, please. Now we move on to just the newer information, and I'm just going to expand slightly on the data that's there. So what we have here is the weekly number of sequence cases in England of the variant B1617.2 first detected in India. And as you can see, this is on a steady upward curve. This is an exponential growth. At the same time as the B117, which is the principal one circulating in the UK at the moment, has actually been on a downward slope. So there is no doubt that this is going up. And earlier this week, we said that we thought that it was as transmissible as B117 and possibly more so. There is now confidence, and SAGE has looked at these data, as have various modelling groups, that this variant is more transmissible than B117. Now, the question in practical terms over the next 2 to 3 weeks is this somewhat more transmissible than B117, or is this a lot more transmissible? And that will have implications for the long-term prospects of this epidemic in the UK and indeed the pandemic internationally. Next slide, please. And this is most clearly seen at the moment in Bolton, although I want to be clear that Bolton is not the only place that has this variant. It is quite widely seeded in a number of parts of England and indeed elsewhere in the four nations of the United Kingdom. And what we have here is rates in Bolton that were going down, but they've really now started to go up very significantly over the last couple of weeks. One important thing that we're not seeing is an increase at this point in time in rates in people over 60. And that is very important because that tends to correlate very closely with people subsequently going into hospital and some people becoming very severely ill and sometimes sadly dying. So this may be a delay, or it may be that the vaccine is helping to protect those who are older and who are vaccinated. And that's an important part of what the Prime Minister has just said. Next slide, please. And if we look at the Greater Manchester area, around the area where Bolton is, as you can see, there isn't at this point in time a significant uptick in the number of people being admitted to hospital. But it's early days, and I think this is the point which we wanted to stress, is this is the first time we have been completely confident of the increased transmission. We now need to see what happens over the next 2 to 3 weeks. Next slide, please. Thank you very much indeed.
Thank you very much, Chris. Let's go to questions from the public. Alexander in Greater London.
If the variants of concern, such as the B1617 variant, increases in transmission to an extent whereby it would result in major hospitalisation, how soon would you implement restrictions, and how many hospitalisations would result in further restrictions?
Thanks very much, Alexander. Well, I think the answer to that sort of flows pretty much from what I said earlier on, and that is that as soon as we saw that there was a risk of a really serious increase in hospitalisations on a scale that would risk overwhelming the NHS in exponential growth, then of course we would implement further restrictions immediately. And the purpose of this press conference is really to alert people to that necessity and to the extent of the risk that we now see in this Indian variant. But Chris, anything you want to add to that? Thank you. Let's go to Josh from Corby.
With universities reopening next week and the restrictions on social gatherings soon to end in June, especially nightclubs, when can the under-30s expect to receive the COVID vaccine? Thank you.
Chris, I'm going to ask for your view on the under-30s.
Thank you. So as I think everyone knows, what we're doing in the UK is going in a very steady, but hopefully rapid and steady progression in terms of vaccination, starting with the most vulnerable people. So those are people particularly of older age, but also pre-existing health conditions. So obviously some people in their 30s, either because they're health or social care workers or because they got pre-existing health conditions, have already been vaccinated, and people indeed under 30. But for the rest of the population, we're going in a steady downward progression in terms of age. And the reason for that is that the risk is very strongly correlated with age. And so, but the rate of vaccination is continuing to be very steady now. We've actually got to the point where people in their upper ages of their 30s, so 38 and 39, and this will steadily move down over the next weeks, are being vaccinated. And we hope to get all the way through to everybody having their first vaccine by the end of July. That is the aim. Additionally, as the Prime Minister has said, there is for people of all ages now an aim to accelerate, to some degree, the point where people get their second vaccination. And there are some advantages to having a second vaccination later, and some data on that, in fact, came out in the last couple of days. But what we do want to do is make sure that people have their second vaccines, and that's why the Prime Minister talked about the fact we're shortening the period from 12 weeks to 8 weeks. And this is because we think that people who've got a second vaccine will have greater protection, not only against the original variants, but also against this new variant. So it is very important that people who get their first vaccine also go on to get their second vaccine. And there's very clear evidence that people are taking that offer up very strongly across the UK and indeed in Bolton and surrounding areas.
Thanks very much, Chris and Josh. Fergus Walsh of the BBC.
Prime Minister, how likely do you think it is that the final unlocking will go ahead on the 21st of June? And for Professor Whitty, do you think that all those over 18 in hotspot areas should now have immediate access to a first dose of vaccine?
Thanks, Fergus. And I know that everybody will be asking that question now. I think the truth is that we at this stage simply can't say for certain. As things stand, you've heard it today that the numbers of infections, even with the new variant, remain low overall across the country. Even in Bolton, where there's been this spike in the new variant, we're not seeing the significant new numbers of hospitalisations. It remains broadly flat, and the situation is different from last year in this crucial sense that we are in the throes of an extraordinary vaccine rollout, which everybody knows and understands. So we've just got to wait and see, those two things: the extent to which the new variant may be more transmissible, and also the extent to which the vaccines have been able to cut the link between infection and hospitalisation and death. And that we just need to see a little bit more about that, I'm afraid, Fergus, before we can be really say much more at this stage. We will continue to proceed with caution, but obviously we rule nothing out. And as soon as we can say more about stage 4, obviously we will.
On the question you asked me, there's been a debate about this, but the JCVI, the Joint Committee on Vaccination and Immunisation, which brings together all the experts on this, has been very clear on this. Now, the fundamental issue is that we have a finite supply at any given moment in time of vaccine. So if you vaccinate one person, by definition, you're not vaccinating another. Now, what do we know certain things about these vaccines. We have very high confidence that the vaccines provide very substantial protection against people dying and people having severe illness and people being hospitalised. Less protection against people having more mild disease, and some protection, but less still, against transmission. And the expectation is with new variants that if you start to lose some vaccine efficacy, you lose it in the opposite direction. So in a sense, you first lose the very low protection of people having asymptomatic or very mild disease. Then you lose the protection against the more severe disease, and finally against the really most severe disease and people having mortality. Now, the reason I'm giving that long preamble is it's to explain why it is that the thing we know this vaccine absolutely can and should do is to protect those who are most vulnerable, and that is very heavily predicated by age with this particular virus. So therefore, if we took vaccine away from groups, let's say, in their late 30s, and transferred them to groups of people who are 18 or 20, who are at much lower risk of severe disease, the view of JCVI, and I think this is the majority view, it's not an absolute view, but the view of JCVI has clearly been this would lead to a net disadvantage overall. So the sensible thing to do is to prioritise the vaccines to those who are most at risk in all the places across the UK, because the virus is a risk absolutely everywhere. But there are very strong aims to try and accelerate and make easier vaccination in the areas which are most affected by this virus. So it's not that we're not trying to take the geographical spread of this new variant, the B617.2, into account. We very much do want to do that.
Thanks very much. Emily Morgan, ITV.
Thanks, Prime Minister. Given that the easing of restrictions is still going to go ahead on Monday, what would you say to someone who's planning to travel to Baltimore?
Because they come back to you for
to visit family. Would you say that they should still go, and should they stay the night?
Thanks, Emily. And I'm very glad you asked that, because I do think it's important that in respect of the areas where we are seeing these spikes, these higher incidences of the new variant, given the caution that I think we have to exercise with this new variant, the risk of extra transmissibility, I would urge people just to think twice about that. That's what we're saying. I think that we want people in those areas to recognise that there is extra risk, an extra disruption, a threat of disruption to progress caused by this new variant, and just to exercise their discretion and judgment in a way I'm sure that they have been throughout this pandemic and will continue to do so, I hope very much. OK, thank you. Sam Coates of Sky.
Hello, Prime Minister. These are your 4 tests for moving to the next stage of the unlocking of the roadmap. The 4th very explicitly says that there can't be variants of concern changing the assessment. Given that cases of the Indian variant have almost tripled over a week, how are you saying that you've passed that test? How are you giving a green light on that? And what happens if, and how can you only say that you've passed these because you're assessing them nationally? If you just looked at one region like the Northwest, might you find that you actually fail several of them? And would you lock back down regionally? To Chris Whitty, there's some data out today suggesting that the Indian variant isn't really rising in the over 45s, a bit younger, I think, than you were saying. Is that right? And to Sir Patrick Vallance, according to Public Health England data, at least 122 passengers arriving from Delhi and Mumbai between late March and April the 26th were carrying this variant. In retrospect, do you think it was a mistake not to close the border from there sooner?
Well, Sam, I'm going to try and pick up the question you directed to Patrick, since he's unfortunately not here. You probably can't see that for some reason, but I will just say on the borders issue, what the relevant committee was looking at was the threat of variants of concern coming from abroad, and at that stage, India was not identified as having a VOC, a variant of concern. So that was why the decision was taken. Pakistan, for instance, I think had 3 times as much of variants of concern. They had, in particular, the South African variant. So that was the reason for that decision. But don't forget that everybody coming, forgive me, from India or indeed anywhere else had to face very, very tough quarantine rules. They had to self-isolate, they had to produce their passenger locator form, and so on. But on the, your fundamental question about the fourth test, I do think that I just go back to the original point. We are concerned about this variant, and that's the purpose, and we're serving notice that I think that it certainly may cause disruption to our attempts to continue down the roadmap, but they don't at the moment change the assessment about step 3, because if you look at the numbers, as I've said, even in Bolton, you're not seeing a significant increase in hospitalisations, and the overall numbers across the country remain, as we've heard repeatedly, low and quite flat. So they're not changing the assessment at present. But what we're saying is that the public need to be aware of this variant, and particularly in areas where it is more prevalent. And that's because of these questions about increased transmissibility. And we just need a bit more time to see how that pans out. And as I said earlier on, whether it's at the higher end of increased transmissibility or at the lower end. If it's at the lower end, then I think we don't have very much to worry about. But if it's at the higher end, then we will certainly have to think about what extra measures we need to take to protect the public. And I want to be clear that we will react fast. We will react as soon as we can see clear and unambiguous data about this, and we will do whatever it takes to protect the people of this country.
On the questions you asked me, and I'm actually going to pick up on the 4 tests additionally. And if you think about the tests and compare them to where we were this time last week, virtually everything is the same situation. There is one very important difference, and that's the one I want to concentrate on. But just to go through them, vaccine deployment programme remains successful. Vaccines reducing hospitalisations and deaths, very clear evidence they are. Nothing has changed on that. Infection rates not causing NHS pressure. You saw the data on that. It's really clear. And on the variants of concern, excluding the B617.2, really no change. Most of them are relatively flat. They haven't gone away as a threat, and but they are staying relatively stable. In terms of the 617.2 variant, one thing also remains the same, which is our current assessment of the vaccine, likelihood of the vaccine being effective remains what it was, which we think it will probably protect against severe disease and hospitalisation. We're not so confident about the degree to which it protects against milder disease and transmission, and that's just we don't have the data. That will come with time. The thing which has changed is the very clear view now, I think if everyone has looked at it, that this is more transmissible than the B117. And we expect over time this variant will overtake and come to dominate in the UK in the way that B117 took over, and indeed other variants have taken over prior to that. Now, as the Prime Minister said, there are kind of some things that we really want to look for, and the most important is this a bit more transmissible, or is this a lot more transmissible? If it's a lot more transmissible, that would imply we could have a really significant surge. If it's a bit more transmissible, that would imply we will have a bit more pressures, a bit more of a race between the vaccination programme and the virus, but we are broadly in the same territory. So that's a really critical question to which we do not yet have the answer. And then the other thing we do not yet know is in practice what the impact of the vaccination programme, and this goes to your second question to me, the question about people over 45. We don't yet have a big enough number, I think, to be confident about this. It could be that it is initially circulating in younger ages because that's what has always happened previously. You start off, people mix more and younger, the initial circulation in younger ages, and then it moves up the age range. So maybe it's just a delay because of that, or maybe it's a delay because the vaccine is actually providing a firebreak, a barrier to reduce the transmission up the ages into those who are most vulnerable. Clearly, the second of those is by far the more preferable. But that we cannot say with confidence at this point, and that's the reason we need to look very carefully at this new variant, see how much faster it's growing than the old variant, and look at this issue about vaccines in practice.
Thanks very much. Sam Lister, The Express.
Thank you, Prime Minister. If you were forced to take the drastic decision to delay June 21st, realistically, how long will that delay be? Will it be a matter of weeks or months? Will we still get the great British summer that we were promised? And to Professor Whitty, given the Indian variant is spreading mainly among young, unvaccinated people, should those people in those groups avoid taking advantages of the new freedoms being introduced on Monday, such as going to the pub?
Well, Sam, I'm afraid I really can't speculate about that in too much detail at this stage, because, as you've heard earlier on, there's just some things we still don't know about this new variant, and we just need a bit more time. I think a couple of weeks we will know a much more than we do now. But I just want to say that, I know this has been a kind of one of those press conferences when everybody hears something slightly disappointing or slightly worrying in the sense that there's a new variant that is a significant concern for us, does pose the real risk of disruption to our plans, and I've got to be absolutely clear with you about that. But it is also possible, Sam, that we could still be on the right track. We could still be set fair, and the big difference between this discovery of this new variant now and seeing the spike that we're seeing in Bolton, the difference between that phenomenon now and is that, and last December, is of course that we have the vaccines, and we're in a very different world now. But as Chris says, we need to be absolutely clear about transmissibility and about the effect of the vaccines on this new variant, and we'll know a lot more in a couple of weeks. Hugo Guy of the Eye.
Thank you. Prime Minister and Professor Whitty, what effect will the decision to prioritise second doses of the vaccine have on the rollout overall? Does this mean younger people will have to wait longer to get their first dose than they would have previously expected? Or is the government finally going to dip into its stockpile of more than 10 million doses that have been delivered to the UK but not yet administered, and perhaps speed up the overall pace of the rollout to match Wales, which, as you know, is now quite far ahead of England, Scotland and Northern Ireland in how many people it's reached with at least one dose?
Chris,
I can certainly take that. I mean, the prioritisation of the second doses will not, we think, delay the situation, the rollout for people who are in younger ages. And there are a number of reasons for that, but one of the key ones is that the JCVI advice is that, except if rates went up very high, and we're not at that stage yet at this point in time, their primary recommendation is that people under the age of 40 will be vaccinated in most cases with one of the messenger RNA vaccines, Pfizer, Moderna, whereas the revaccination programme is largely, at this point, with AZ vaccines. So the expectation is this should not lead to significant delays. We don't have that trade-off, which has been the issue elsewhere. It is, though, to reassure people, we are very clear that we still want to maintain a slightly longer gap in terms of vaccination, 8 weeks rather than the rather shorter periods in some countries, and that is because we do think there are some advantages to that. So we're doing this relatively steadily. That was the advice from JCVI, and I think they've given some information about that today.
Thank you very much. Alistair Smart of Reuters.
Prime Minister, do you think you might one day look back on the decision to ease restrictions across the whole of England this Monday as a big mistake? And with international travel restarting, should Brits realistically expect to get a summer holiday, given the risk of importing new variants, as happened with this one? Thanks.
Thanks very much, Alistair. And on the, I think that we're in a different position from much of the past year, 14 months, 16 months or so, simply because we were able to see so much so early. And thanks to the testing that we're doing, thanks to the genomic sequencing, we're able to spot stuff really very fast. And so what we're trying to say at this press conference is that we do see a real risk of disruption in the new variant. We think that on balance, it's right to proceed with the current plans, given the very low numbers, given the fact that hospitalizations are not rising. But obviously, we remain very, very alive to any change in the data, and we will react accordingly. And the same, I think the same spirit of caution should be applied to people who are thinking of travelling abroad. There's a very limited list, as you know, and we will certainly be making sure that people going to travelling abroad will be subject to all the tests and constraints that people would expect to prevent the virus being re-imported. That's why it's such a tiny list of countries, and I don't expect that we'll be adding to it very rapidly. And indeed, we will be maintaining a very, very tough border regime for the foreseeable future, I imagine. It's just too early, I'm afraid, Alistair, to talk about exactly what the summer will be like. We've seen this new variant arrive. We've been watching it for a while. We're now seeing the risk that it's more transmissible than B117. We have to take account of that. We have to alert people. We have to give guidance and advice to people in areas where it's been surging, even if the numbers are currently low. And as I've said to everybody, we'll know more in a couple of weeks. We'll know a lot more in a couple of weeks, and we'll keep everybody updated as fast as we can. This doesn't mean that it's impossible that we'll be able to go ahead with step 4. I don't think that's the case at all. But it does mean there is now the risk of disruption and delay to that ambition, and we have to be utterly realistic about that. And I want to stress again, we take nothing off the table as a means of controlling this virus and this variant, and we will do whatever it takes to keep you all safe. Thank you very much, everybody. Thank you.
Well, there we are then. The Prime Minister ending today's news conference at Downing Street lasted just over half an hour, didn't it? So let's round up what he had to say, specifically talking about this new Indian variant, a variant of concern, saying that we'll have to see if it is significantly more transmissible than previous ones, which that could lead to some hard choices. The race, he said, between the vaccination programme and the virus could be, he admitted, about to become a lot tighter. One thing he did state as fact is that he's going to accelerate second doses for over 50s and those clinically vulnerable. Well, listening to all that and asking the questions for us as our Deputy Political Editor, Sam Coates, as you can see there. So we know that this next stage of unlocking will happen in a couple of days, on Monday, the 17th. That is going ahead as planned, but serious doubt, it seemed. I mean, looking at these words here, not impossible that June the 21st will happen, but it looks to be in doubt, certainly now, doesn't it? And the Prime Minister had indicated just days ago that we were on course for that unlocking then, but perhaps not.
The Prime Minister putting the nation on notice that the next stage after Monday, so the stage in June of unlocking, may not take place. That's right, Nick. It was quite a dramatic press conference. Some of those phrases that we have come to sort of dread, talking about hard choices that he's going to have to make if it turns out that the Indian variant is more transmissible than we thought. The Prime Minister effectively delivering two parallel stories today. First of all, he confirmed formally that the lockdown lifting on Monday was going to go ahead. So this is the change that can see people go into one another's houses, go into restaurants and pubs and meet each other inside, which they haven't been able to do. So all of that can take place in England. That's also been confirmed for Wales and large parts of Scotland today, although there are a couple of areas of Scotland where some restrictions remain in place. So that will go ahead despite the emergence of this new variant of concern, and despite the fourth test in order to move through the roadmap being the fact that there's no variant of concern that changes the assessment. So green light to Monday, but the bulk of the Prime Minister's opening really given over to that warning that there were tough decisions ahead. And if this progresses, if this new variant does go through and speed up and take off across the country in the way that we saw with the Kent variant back in December, then that could mean that the restriction lifting, the opening up, the complete unlocking that we were expecting in June doesn't take place. Now, there's an absolutely critical remark by Chris Whitty in his answer to my question. When I asked about the Indian variant and whether or not we could continue unlocking, and whether or not there was little sign of a rise in people over 45 getting it because of the effect of the vaccine, he said the thing that has changed is the very clear view that this is more transmissible than the Kent variant. We expect with time that this variant will overtake and come to dominate in the UK. So the Indian variant really has been an issue in Whitehall for the best part of this week, but it does seem as if within weeks it will be the principal and dominant variant. Now, Boris Johnson is very keen to stress that there's no evidence of it being additionally dangerous. There's no evidence that it's more vaccine resistant than anything else. But nevertheless, this is a concern. So let's listen to one of Boris Johnson's warnings as he set out the reasons for concern.
I have to level with you that this new variant could pose a serious disruption to our progress and could make it more difficult to move to step 4 in June. And I must stress that we will do whatever it takes to keep the public safe. Our surveillance and data gathering is now so advanced that if there was a danger of the NHS coming under unsustainable pressure, we would see the signs in the data very early on and could react in good time. And that gives us the confidence to continue moving forwards for now.
So the Prime Minister promising to level with us, that phrase, that almost dread phrase that he used right at the start of the pandemic during the first lockdown, now having to be rolled out again because of the levels of uncertainty. The specific decisions that we got today, they are going to double down on trying to get the over 50s vaccinated, speed up the ability of people to get their second jab, bring that forward from 12 weeks to 8 weeks. They're going to allow some over 45s and to get their jabs as well more easily and concentrate on that. It seems rather than vaccinating people in their 20s and 30s more quickly. But how else the government will respond, well, I suspect we'll hear about that in the days to come.
All right, Sam, many thanks indeed for watching over all that for us. Well, let's get some instant analysis. The Lib Dem MP